Assalamualaikum warahmatullahi wabarakatuh. Welcome everyone to CME Med My, and we have our dietitian today, Miss Jazlina Syahrul, and she will be presenting on dietary management during Ramadan. This is a very important topic now that we're entering Ramadan in a few days' time. So I hope you can still share with your friends and family members the Zoom link and also the Facebook Live link so that they can also benefit from this session. So without further delay, I would like to invite our own Ms. Jazlina.
Okay, Assalamualaikum and good evening everyone. Thank you Dr. Hafsah for a very kind introduction. So before I start, I just would like to share one video. So
Hai, saya Syahrul, pensyarah pengadai dan juga ketua di Jabatan di Hospital Pengadai. Tahukah anda peran sebagai seorang dietitian? Jom kita seperti diet, kami nasi putih, ikan serai. Inilah dia saya bilang. Memantau makanan sakit pada makanan dan sebagainya.
Semasa melihat sakit, kami juga menentukan tempat dari pesakit bagi memastikan sakit mendapat keperluan pemakanan yang optimal.
Dietitian juga berperanan dalam merancang pemakanan enteral bagi pesakit.
Selain memberikan perkhidmatan klinikal kepada pesakit, ada juga dietitian yang bekerja dalam bidang akademik sebagai pensyarah dalam bidang dietetik, dan juga dietitian kami turut menyediakan aktiviti pembelajaran dan pengajaran kepada pelajar dietetik di hospital sinonim dengan nama Hospital Pengajar UPM.
Tugas dietitian juga adalah untuk memberikan kaunseling perkhidmatan kepada pesakit. Ia adalah untuk memastikan penjagaan makanan terjaga. Itulah antara tugas-tugas seorang pegawai. Sekian Ask My Dietitian.
okay, so that was just an introduction. What is actually dietitians do? So many of us may not know what is actually dietitians do in hospital. So that was just a brief introduction. So today my topic will be dietary management during Ramadan. Okay, so this is my outline of presentation today. So I just will have a definition a bit about Ramadan and dietary recommendation during Ramadan for general population first, and then I will introduce a bit about therapeutic diet, and then we move to Ramadan fasting for our NCD patient, and then I will conclude my presentation. Okay, so many of us already know what is Ramadan, but maybe this is just a brief introduction for our non-Muslim friend. So what is actually Ramadan is a holy month of which occur on the 9th month of the lunar-based Islamic calendar, and all Muslims are required to abstain from eating from dawn to dusk for around 30 days. And this act of fasting is meant to remind Muslims of the less fortunate and to reinforce the need to be thankful. So actually Ramadan is often seen as a time to practice self-control, self-discipline, sacrifice and empathy for those who are less fortunate. And it is actually encouraged to try to maintain this practice even outside of the fasting hours. Okay, so let's look into the evidence base regarding the Ramadan fasting. So Ramadan fasting is actually one type of the intermittent fasting. So from this study, they compare intermittent fasting diet with control diet, and they found that it was associated with significant decline in BMI, reduction in fasting glucose level, and improvement in insulin resistance. So they conclude that intermittent fasting may provide a significant metabolic benefit by improving glycemic control, insulin resistance, and reduction in BMI for general population. So let's look into Ramadan fasting. They found that there is a significant reduction in fat percentage between the pre and post Ramadan for people with overweight and obesity. And they also found that there was a significant loss of fat-free mass between pre and post Ramadan. However, they also found that after 2 to 5 weeks after the Ramadan end, there was a relapse or return towards the pre-Ramadan measurement in terms of body weight and body composition. So this shows that Ramadan might be a good time or a kick start time for us to fine tune our daily intake and lifestyle. And this should be maintained after the Ramadan. Okay, and this recent study shows that the most promising health outcome during Ramadan fasting appears to be the improvement in lipid profile, and this improvement often extend even after the Ramadan fasting. However, there is some contradictory result in terms of the outcome due to cultural variation in dietary habits, different in the duration of the fasting due to the seasonal or climate difference, geographical location in terms of age, gender, and SES or socioeconomic status. Because some of the country, they had different culture, how they celebrate the month of Ramadan. But however, they found that there's improvement in body composition or metabolic parameters when they consume more fruits and vegetables. So they recommend to follow this closely lah. Okay, so that was for general population. I would like to share one video again. Okay.
Assalamualaikum warahmatullahi wabarakatuh. Saya Dr. Nisa ingin berkongsi tips kekal bertenaga sepanjang hari di bulan Ramadan. Ramadan adalah platform terbaik untuk kita fine-tune corak pemakanan yang lepas supaya meredakan selera yang membuat-buat sekaligus mencapai cara hidup yang lebih sihat. Bersahur adalah waktu makan yang paling penting untuk kita berpuasa. Sebagaimana sarapan, ia memberi kita tenaga untuk kita kick off hari kita seterusnya. Pilihlah makanan yang rendah indeks glycemic kerana ia akan lambat dicerna dan diserap sekaligus memberi kita rasa kenyang yang berpanjangan. Antara contoh makanan rendah indeks glycemic adalah seperti susu, nasi dari pilihan beras yang panjang seperti basmati, separuh rebus ataupun beras peram, roti daripada pilihan berserat tinggi, oats dan kacang seperti dal. Jangan jadikan alasan mengantuk dan letih untuk tidak bangun bersahur. Cukup dengan hanya makanan yang simple tapi berkualiti seperti segelas susu dan oats serta beberapa keping biskut bagi memastikan kita mempunyai tenaga yang optimal dan berpanjangan. Sahur adalah waktu makan yang paling penting. Ingat, biar ringkas tapi berkualiti. Selamat bersahur.
Right, so that was for general population or for those who would like to, for those who are what we call overweight or obese population. Okay, so what is a dietary recommendation during the Ramadan for this group of population? So we encourage to drink adequate amount of water, as well as to replenish energy with mini iftar first. For example, dates to replenish back the glucose. Then we do suggest to avoid large meal during iftar because big meals can cause heartburn and discomfort, especially for those who have gastritis. And then we do encourage to enjoy healthier cooking method for protein portion. This is very important to provide satiety. So it will avoid us to overeating. And then we do also encourage and it is highly recommended to eat sahur as per Dr. Nisa said just now. And we do really encourage healthy balanced meal. Okay, so we also suggest to incorporate plenty of vegetables to provide vital vitamins and nutrients. And actually, vegetables is very important to provide satiety. Okay, so we already know that there is much benefit of Ramadan fasting for general population or for those who want to reduce their weight during fasting. So should we recommend our patient to fast? How about our patients? Okay, in Islam, there are several excuses for not fasting. However, some of our patients may still choose to fast. Some of them may discontinue their medication or alter their treatment regime without consulting with their physician. This may lead to severe complications such as hypoglycemia, hyperglycemia, and it can be as bad as DKA. So with careful support and advice along with the shared decision making between us and the patients, successful health outcome and safe fasting can be achieved. Alright, so as a dietitian, we will use MNT or medical nutrition therapy in managing our patient. So what is MNT? It is an evidence-based application of the nutrition care process. It's actually a process which we provide to our patient or client. These four domains, we will do nutrition assessment to our patient, nutrition diagnosis, nutrition intervention, nutrition monitoring and evaluation, which is this typically result in the prevention, delay or management of the disease or the conditions of our patients. Okay, so I'm going to share a bit about therapeutic diets. The therapeutic diet is a diet that is modified in nutrients content to meet the nutritional needs of patients or disease. When we talk about patients, so of course, our patients are not what we call is not wajib to fast, but however, therapeutic diet is usually served in hospital for patient in wards, and some of our patient may request or some they will ask, boleh tak nak puasa? So of course, when we talk about fasting, it need to be determined or need to be discussed with the primary team first whether this patient are suit to fast or not. Okay, so this is the example of the diet that we serve in hospital. This is the example of the normal diet. So next is the diabetic diet. So you can see that there is a significant difference in terms of the carbohydrate, the rice serving and the fruit serving. Okay, so this is the example of low salt diet in hospital. Usually for low salt diet, all the dishes and the meals are no added salt at all. So we will provide a sachet of salt or sodium chloride, which is to ensure that this our patient with low salt diet will have less than 5 grams of salt intake in a day. Okay, so this is the what we call patient is in ward. So how about our patient or NCD patients? So today I'm going to share more on diabetic diet management because this is the most common comorbid patient that we see, especially in clinic. So previously before Ramadan, most common question by our patient, boleh tak nak makan apple merah? Tapi dia rasa manis. Kalau saya makan apple hijau lebih baik tak? Because rasa apple hijau kan masam. Okay, but when Ramadan is approaching, most of the question will be changed to boleh tak nak makan kurma? Kurma rasa manis. Tapi kalau saya nak makan sikit boleh tak? Okay, so I'm going to share more regarding this. Okay, so let's look into the general management for type 2 DM first. So when we talk about diabetes, so what come in our mind usually will be carbohydrate. Of course, carbohydrate will be the main management for our patient. So total carbohydrate intake should be monitored in type 2 DM individuals, and there is a minimum amount of carbohydrate which is 130 gram of carbohydrate per day should be provided to ensure adequate intake of fiber, vitamin and mineral, as well as to prevent ketosis and to provide dietary palatability. Okay, when we talk about carbohydrate, of course, sucrose is included. The allowance is 10 to 20% of total energy, and it is counted as part of the total carbohydrate allowance. Okay. So for Ramadan, there is a new guideline, Diabetes and Ramadan Practical Guideline 2021. So the nutrition aspect in the chapter 8. So I will discuss more about this. Okay, so of course, when we allow our patient to fast during Ramadan, for our diabetic patient, if the pre-Ramadan diabetic education should start, it is recommended to start 6 to 8 weeks before the Ramadan. So there is a few key component of Ramadan focused educational program. Our of course, our patient need to be risk stratified first. We need to do risk stratification. Okay, to stratify our patient, our diabetic patient, whether they are in a low category or moderate or in high risk group. Okay, so today I'm going to talk more on fluid and dietary advice. Okay, in your opinion, what are the challenges for our patients during Ramadan fasting? Some may say that it's Bazar Ramadan and rasa haus, and some of them also shared that it's very hard to bangun sahur to have complete balanced meal. Okay. Okay, so let's look into the Ramadan meal timing. This is the common meal timing during Ramadan. So we will have sahur or pre-dawn meal. We have berbuka or after sunset meal, and we also usually have snack and more. However, there is time or danger time to buy food for our patient, usually after asar or around 5 p.m. So this is the very danger time for some of our patient, because at this point of time we will feel very hungry, and when we go to bazaar everything looks very nice. Semua rasa nak beli for some of our patient sharing lah. Okay, so what's the aim of the MNT during Ramadan fasting? So of course, first is to provide adequate amount of calorie with balanced proportion of macronutrient. So during the period between sunset and dawn to prevent hypoglycemia. Then we aim to have consistency in terms of carbohydrate distribution among meals to minimize postprandial hyperglycemia, and consideration of other related comorbidities such as hypertension and dyslipidemia. Okay, there is some health issue during Ramadan among our diabetic patients. So first is I'm going to talk more about hyperglycemia and hypoglycemia. So why this happen among our diabetic patient? Usually it's because large meal at iftar, it will cause severe postprandial hyper and weight gain among our patients. Some of them consume highly processed carbohydrate and sugar at iftar or between iftar and sahur. And some of them also consume dessert loaded with sugar after iftar, and frequently eating snack. When they feel very hungry, they will eat at fast speed, and this can lead to overeating. Okay, how about hypoglycemia? So this might be due to skipping meal at sahur or consuming meals for sahur too early. For example, they wake up for tahajud around 3 a.m. So they say that alang-alang sahur lah sekali. So this will give risk of our patient to have hypoglycemia during the fasting day, right? Okay, some of them also eat too many fried food and changing in physical activity and sleeping pattern, which may lead to weight gain. Okay, so for our diabetic patient, this is the recommendation in the guideline, the Ramadan nutrition plan calorie guide for weight reduction and weight maintenance. This is the algorithm one. So for our diabetic patient who are overweight or obese, Ramadan might be one of the time for them to reduce their weight, because we know that weight reduction can give benefit for our patient in terms of glycemic control. So this is the general recommendation of the calorie requirement for weight maintenance and weight reduction, as well as the calorie and carbohydrate distribution. So it needs to be consistently distribute between all the meal timing. So for our patients, our diabetic patient, we do suggest to have sahur, mini iftar or iftar snack before they do Maghrib prayer, and then after the Maghrib prayer, that we suggest to have iftar meal, and as well as healthy snack. This is more actually, if necessary. So for our diabetic patient, we really do encourage to have sahur as late as possible and iftar as early as possible. Okay. Okay, so let's look into the point number one. What is the recommendation for our patient? Of course, the hydration status. So for our diabetic patient, we need to ensure they are adequately hydrated, and this fluid intake need to be distributed evenly. We do suggest our patient to minimize caffeine and sweetened beverages and cola drinks, and to reduce the salt intake to reduce their thirst. Okay. Um, okay, so this for our diabetic patient, hyperglycemia and hypoglycemia is one of the complications that they might be get when they are do fasting during Ramadan. So we need to ensure our patient understand regarding the energy balance first before we talk about carbohydrate management. Okay, this is because different macronutrients have different effect on blood sugar increment. This combination of macronutrient is very important to have better glucose control for our patients. And this combination of macronutrient also will make our patient become more satiety, because we need to remember that the more satiety our patients are, the more stable their blood sugar. Okay, so this is the example of Ramadan plate for our patient. Okay, so we do also recommend uh, soup or clear. Usually we will recommend clear soup with low healthier cooking method. Okay, so to replenish the fluid, right? So this is the example of the portion size. How we teach our patient to do portioning by using their hands. This is one of the way lah how we teach our patient. Okay, so let's move into the carbohydrate management. So when we talk about diabetes, we always remember about carbohydrate. Some of our patient thinks that, oh, kalau ada kencing manis nanti dah tak boleh makan nasi. So for the carbohydrate, too much of carbohydrate intake will lead to hyperglycemia. Too little of carbohydrate will lead to too much carbohydrate will lead to hyperglycemia, or too little of carbohydrate will lead to hypoglycemia. So it's like a love-hate relationship with the carbohydrate. So for our patient, how we teach them about carbohydrate management, this is one of the way how we teach our patient regarding the carbohydrate management by using the 3T method or 3J. It is total, timing and type, or in bahasa it is jumlah, jadual and jenis. Okay, so we need to ensure our patient know how much their total carbohydrate requirement. So different patient had different requirement. So 40 to 50% of the total energy requirement must come from the carbohydrate. So when our patient asks, tak boleh je nak makan nasi kalau dah ada kencing manis. So of course, rice is one of the sources of the carbohydrate. So we will usually we know patients already know when they had diabetic, they know already they need to reduce their carbohydrate intake. But we need to teach patient how much. When we ask patient to reduce the carbohydrate intake, so we need to ensure that patient have still adequate amount of carbohydrate. Okay, so timing, appropriate distribution for main meal and snack, if necessary during the Ramadan period. And then type, we do really encourage to choose low GI and whole grain. Okay, so this is the example how we distribute carbohydrate. So teach our patient about carbohydrate exchanges. Okay, different requirement of calorie per day will have different amount of carbohydrate. So this is the example for 50% from the calorie requirement. So we will distribute evenly for sahur, mini iftar, iftar, and more. So usually the main meal for sahur and mini iftar, the amount of carbohydrate allowance will be a little bit higher compared to mini iftar and more to prevent the postprandial hyperglycemia. Okay. Okay, so our patient need to know how much is the one exchanges. So this is to ensure that they know how to adjust their carbohydrate intake for each main meal. So after we introduce our patient about the carbohydrate sources, we will teach carbohydrate counting. So they know how to adjust. If let's say they don't want to eat rice, so how much they can eat potato, how much they can eat bihun, how much they can adjust their meat intake, or if they want to change to bread. Okay, so they also need to know some of the hidden sources of carbohydrates. Some of them, uh, some of our patient don't really sure what is actually carbohydrate set from the cereal base. Okay, so how about sucrose? So of course, sucrose we do allow our patient to take, but some of our patients didn't really know where the hidden sucrose come from. And some of our patient also said that, oh, kalau gula perang bolehlah ambil lebih kan sebab kan lebih baik. Okay, so it's actually they need to know how much of the allowance of the sucrose is actually the same, still in the sucrose or carbohydrate sources. Okay. Okay, so caution should be practiced when we allow sucrose for our patient, because excessive sucrose may lead to weight gain, and it's actually the high sugary foods are low in nutritional content. So we still need to limit the sucrose intake for our patient, because some of our patient their understanding like kalau minum sirap tapi tak letak gula, tak adalah gula kan. So it's actually we need to empower our patient to know what is actually the carbohydrate comes from. Okay. Just now I do mention about dates or kurma. Some of our patients are really keen to eat kurma. So from this study, it shows that actually carbohydrate content in kurma come from fructose and glucose. And they do the study for this 5 type of kurma or dates. The GI value is actually range from 45 to 50, 43 to 55. We do allow our patient to take dates during mini iftar, and it need to be moderate intake for about 2 to 3 pieces and combined with sufficient fluid. Okay, and date is actually high in fiber as well. Right. So when we talk about a complete balanced meal, just now I share about the Ramadan plate for our patient. So we do encourage our patient to eat veggie first. Okay, one study shows that they compare between eat veggie first with conventional routine method. They found that significant increase in consumption for green vegetables among the subject, and this group had achieved better glycemic control and significant improvement in HbA1c for over 24 months. So this is very important for our patient, because in our country, rice or carbohydrate is our staple diet. So when we ask our patient to eat veggie first, so this will ensure our patient to have veggie in their plate, and it actually will provide satiety to our patients. Okay. Alright, so this is the usual sahur for our patient. Some of our patient really hard to have what we call complete balanced meal or couscous paru for sahur. So usually they will just have one type of meal, for example, fried rice. Okay, there is recommendation in the Ramadan nutrition plan to incorporate disease or diabetic specific formula to sahur meal. Okay, this is because what is actually diabetic specific formula? It is a complete balanced meal formulated for patient with diabetic, and it has been DSF is actually had been used as part of the meal replacement during the non-Ramadan period. And uh, this study shows that there is potential use of DSF to complement the diet intake during Ramadan, especially to improve the dietary adequacy. And this DSF actually also contain fiber, so it will complement the dietary intake, the complete balanced meal during the sahur. Okay, and this actually will help our patient to have more satiety. Okay, so as of course this recommendations need to be tailored with individual, right? Okay, so this is the example of one day menu or one day menu planning for diabetic patient. They need to have sahur for exchange of carbohydrate during sahur, 2 exchange of carbohydrate for mini iftar, and then another 4 exchange after Maghrib prayer, and 2 exchange during Moreh. Okay. So I'm gonna share a bit about hypoglycemia. So how to prevent our diabetic patient from hypo during Ramadan fasting. So we do highly suggest that our patient to take sahur as late as possible. Of course, they need to have adequate carbohydrate intake toward during the day or non fasting period, and then especially during the sahur. Avoid rigorous exercise before berbuka or during before the sunset, and of course we need to have pre-Ramadan adjustment regarding the diet and medications, and we need to ensure our patient have blood glucose monitoring at home. Okay, so what if hypo happen? Hypo is when the blood glucose is less than 3.9. We need to give 15 gram of fast-acting carbohydrate, which is mainly come from sucrose. So, for example, a small carton of juice. Some of the patient will ask, kalau makan biskut 2 keping boleh tak? So it's not work for if patient already have hypo, they need to have fast-acting carbohydrate. So wait for 15 minutes and recheck the blood sugar level again. Give another 15 gram of carbohydrate if necessary. And then we do suggest avoid overtreatment because excessive amount of carbohydrate or glucose intake may result in significant hypoglycemia within the next 4 to 6 hours. Okay, how about physical activity for our diabetic patient? Right, this guideline suggests that rigorous exercise should be avoided for our diabetic patient. We do encourage to maintain their normal physical activity during Ramadan, and actually Tarawih prayer. This repetitive movement of bowing, kneeling, and rising should be considered as part of their daily exercise activity. And individuals are more likely to achieve their HbA1c target and reduce body weight when they do more nightly prayers. Okay. Alright. So as a conclusion, the Ramadan nutrition plan or Ramadan diabetic management during Ramadan need to be tailored or individualized for our patient, and we do really encourage patient to be referred to dietitians for individualized Ramadan nutrition plan. Okay, so that's all from me. Thank you.
Okay, thank you, Jaz, for the very informative talk. You give a lot of insight into the appropriate dietary management during Ramadan, and I'm sure we have a lot of questions. I think we have a few questions already. Is that right, Is?
Yeah, it's true.
Okay, so maybe
Okay.
I'll pass the session, the Q&A session to Is, and then we'll take it from there.
Okay, thank you, Dr. Hafsah. Okay, yes, okay, thank you very much for the excellent talk. Actually, I also have my
Thank
own
you,
question
Dr.
for you.
Me
Okay,
too, me
Okay.
too.
uh,
Alright.
okay. The first question is from our chief, Khairul Hafiz. Which one is
Okay.
better, fasting sunat or intermittent fasting?
Actually, it's about the same. Because intermittent fasting had different type of time. Ramadan fasting is one of the what we call one of the intermittent fasting. So for Muslim, they may feel like Ramadan fasting is better because when it's like two in one, we do intermittent fasting and we also get pahala or something like that.
Okay. Yeah. Actually, it's the same lah. It's
Yes.
fasting dengan sama.
So Ramadan is like a form of intermittent fasting, is that right?
Yes, yes.
Yes, perfect.
It's
Okay.
one type of time restrictive intermittent fasting lah. Time restricted fasting.
Okay. The next question will be from Amanina FMF.
Alright.
Assalamualaikum. What is the easier way to calculate calories to be applied without using an app? Because not all food are in the apps. Okay.
Okay, alright. So it's a hard question actually. Okay, so how to calculate calories? So of course, we need to know where is the calories come from. It's come from our macronutrient. It's carbohydrate, protein, and fat. So how to calculate calories is more to like we teach our patient to know the serving size. So we need to teach our patient one serving of carbohydrate how much, one serving of protein how much, and one serving of fat how many calories in there. Okay, let me show the picture of okay this sorry picture of hand. Okay, so this picture is actually a bit complicated if we ask our patient to calculate by their own with what we call macronutrient, carbohydrate, protein, and fat, because different type of cooking method had different type of calories. So we do suggest our patient to know the calories come in term of serving size lah. For example, kalau one serving of mi berapa kalori, one serving of roti canai berapa kalori. So just a brief idea lah about calorie. Actually, one exchange of carbohydrate is around 75 calories. One exchange of protein or 1 pound size of protein is around 130 calories, and one fat is around one small feast or not feast. The circle one is around 1 teaspoon of fat is about 45 calories. So it's a bit complicated if because actually we need to have a class to teach about the calorie counting lah. So the most easiest way is from the apps, and one of the easiest way we can share to our patient about the serving size, the in term of meal, because the calorie I said just now is the raw is from the raw foods. It's not about it's not the meal. Okay, so I think apps and in terms of serving size will be better lah for our patients.
Okay. Okay. Next question also from our chief, Khairul Hafiz. This one is a bit okay lah. It depends on your workload. Can dietitian cope if all the M patient being referred to you all?
Okay, so it depends on the situation. Of course, we need we very welcome for physician or doctors or any other healthcare members to refer patients to us. So actually, if we the easiest way, if we can't do the individualized dietary counseling, we do have group counseling for all patients. So I think if let's say the time given or mungkin pre-Ramadan we can't afford to have much patient, we can do group counseling for our patients.
Okay, good. Okay, next question from Noor. What is the best meal for sahur for gastritis patient?
Gastritis patient. Okay,
Hmm.
so for gastritis patient, first they need to avoid caffeine because it will induce gastric juice, and then avoid the what we call um, any spicy food, any um, something yang masam. So the best meal would be, of course, complete balanced meal. So just avoid high fat food because high fat food will lead to delayed stomach emptying. So patient for those who have gastritis will feel more bloated lah after they take high fat food. Okay, of course we do really encourage for those who have gastritis to have more veggies and fruits during sahur to have more satiety and prolong their feel of fullness.
Okay. Okay. So next question will be from me lah. Can eh?
And
Okay.
sure, doctor.
My question is actually now we see that a lot of company selling sugar lah, especially brown sugar now promoting themselves that they have a very low calorie. Tapi
Okay.
from your slide, actually 3 spoon of sugar, white or brown, have the same amount of calorie, 15 gram, right? 15 gram,
Yes.
right? Like that.
Yes.
So can you elaborate more? Yes.
Alright. So regarding the sugar, currently so many type of sugar. Some sugar is like they claim that brown sugar is better than white sugar, like Dr. Is mentioned just now. So it's actually we need to teach our patient what the amount. The amount of carbohydrate is still the same, regardless how what type of sugar they take. So maybe in term of brown sugar, for example, for brown sugar, it might be better in term of minerals, in term of, like, for example, potassium. Okay, the content lah, and maybe slightly different in term of GI value. So we do suggest our patient to know where the sugar comes from. Tak kisah asal namanya sugar, it's still sugar. So 3 teaspoon or 15 gram of sugar is actually like one scoop of rice, already one scoop of rice, one exchange of carbohydrate. So let's say they already take around 1 glass of drinks with brown sugar. So still it's still sugar, so we need to actually empower our patient to know, especially the nutrition labeling, know what type of carbohydrate they consume lah.
Okay. Okay. So next question from Dr. Lai Salimah, our ophthalmologist. My mother said we should take more meat and fat based food as it provides longer lasting energy. Is this true?
It's okay. So it's partially true because when we have complete balanced meal, protein and veggies, it will provide more satiety, and it's actually have um, it had effect on our blood sugar control as well. So but patients still need to have an adequate amount of carbohydrate. So if we consume more protein, we need to know, we need to remember that protein also have calories. So more protein intake will provide more calories, and especially we need to know what the cooking method. For example, kalau makan ayam goreng 2 ketul, is actually will provide more calories for our intake lah. So this unnecessary calorie might lead to weight gain.
Okay. Okay. Next question will be from Shira. Does diet for diabetic patient can be practiced by person with no diabetes? Thank you.
Yes, yes, it's actually pretty much the same for non-diabetic patient. It's more like why we call diabetic diet, because we want to ensure our patient to have evenly distributed carbohydrate. So for the calorie, of course, it will suit for non-diabetic patients.
Okay. Next one, the last one is a question from Dr. Izzat. So just you recommend sugar substitute for my pregnant patient, pregnant ladies?
Okay, so as far as I concern, the sugar substitute or we call non-nutritive sweetener are safe for pregnant lady, but there is some of type of sweetener are not suitable for pregnant lah. Okay, but if usually we will suggest if patient really unable to what we call control their sugar intake. If let's say patient okay je tak minum manis, so we don't suggest the sweetener lah, because sometimes this sweet taste will make us feel more more selera, what you call we tend to eat more lah when we have this sweet taste.
Okay, okay. I think that's all for the question. Sorry, got another one question from Chip. Okay, artificial sweetener can increase glucose level in DM patient?
No,
No.
because it not contain glucose.
Oh, doesn't contain glucose.
I
Okay,
have questions as well, Jas. If that's okay.
Sure.
I think we all have a lot of questions, is right? So
yeah.
so Jess, I think earlier you mentioned that we have to tailor the calorie intake to the energy requirement. So obviously everyone has different occupations, and also the amount of maybe housework they need to do during the day is different. The amount of exercise they do and the frequency is different as well. So the physical activity, in short, is different for each individual. So how, maybe basically, I know this is probably a topic on its own, but would you mind sharing with us how do we calculate, the energy requirement for ourselves individually?
Okay, for ourselves, usually we will determine our BMI first, whether we are in which category, whether we are underweight, normal or overweight. So usually for normal population or normal people, we just can straight away use our weight to determine our calorie requirement. For those who are underweight or overweight, we need to determine their ideal body weight first, because of course for those who are overweight, we need to reduce their calorie intake to reduce their weight. Okay, so usually we will use quick method. For example, our weight is like 50 kilo. So for those who are in normal body weight, we can just straight away divide with darab with 30 kilocalorie per day. So it's around 1,500. Okay, so this is the what we call the easiest way lah. But for example, for those who are overweight or obese, and we do consider their physical activity, their occupation, of course their BMR. So it's actually a bit more complicated in terms of our clinical judgment. It's more like we need to know first what is their current intake. So if let's say patient or that individual is having 3,000 calorie per day, so we can't just straight away reduce to 1,500. They won't comply lah. Okay, so it is more like to
gradually
gradually reduce. Yes.
Yeah, bring it down to the ideal
Yes.
calorie intake as suited suitable for that certain individual. Okay. And the second thing, I think this is quite basic as well. You mentioned that high fiber diet is good during sahur. Okay, makanan yang tinggi serat bagus untuk sahur. Jadi boleh tak just kongsikan, mungkin kat Facebook Live ada ramai juga yang ikut talk ni jadi kita nak kongsi apa contoh-contoh diet yang tinggi kandungan serat. Sebab senang untuk kita cakap, tapi sebenarnya apa makanan-makanan yang tinggi serat ni sebenarnya, Jas?
Okay, makanan yang tinggi serat, of course first serat ni datang it come from our fruits and veggie. Okay, so of course during sahur tu the easiest way, kalau susah nak masak-masak veggies, so the easiest way to have like raw ataupun ulam, like salad, tomato cherry is the fastest way lah. Terus basuh and then terus boleh makan. Some of the other example of the serat is come from whole grain. So it's come from our wholemeal bread, wholemeal pasta, brown rice, and then for example like oats. So that was one of the example of serat lah.
Okay, okay.
Ada tadi ada tambahan kan?
Ada. Sekarang hari ni Cip banyak soalan Okay. So the next from Cip
Sure.
is there any specific diet for cancer patient during Ramadan?
Ini popular ni Jazz ni. Orang kata
Okay.
ambil gula kata.
Okay, so for gula, selalu orang tanya boleh ke orang kanser makan gula putih, right? So there is no conclusive evidence on that. Tapi untuk cancer patient, kena tengok dulu whether patient able to fast or not. Usually for cancer patient, kita akan tailor to treatment. Patient tu on chemo or radio or just for conservative management. And kita akan tengok comorbid juga. If let's say patient ada any comorbidities. But the usual diet for cancer patient with treatment is high protein diet.
High protein diet.
High protein diet.
Okay. Okay. The next one from Dr. Anwar Fazal the last question Just apakah cara yang cepat nak reduce fasting blood sugar?
Okay, cara yang cepat nak reduce fasting blood sugar pada pendapat saya is more like medication lah, is lebih kepada role of medication. So ada contohnya patient on insulin ke tak. Sebab kalau on diet, bila dah fasting blood sugar dah increase or patient already in hyperglycemic state, usually kita akan ask patient untuk sama ada adjust the next meal lah. Tapi if let's say kalau contohnya yang ni bukan waktu puasa, contohnya lunch memang dah sugar tinggi, tapi dinner kita tak akan ask patient tiba-tiba tak payah makan. Just do like the intake is still within the recommendation lah. Then kita akan identify patient kenapa sebenarnya blood sugar tu tinggi. Tapi cara yang cepat untuk reduce fasting blood sugar kalau dah tinggi is more like saya rasa kepada medication adjustment lah.
Okay. Very good answer. Okay, I think that's all for the question. I give back the floor to Dr. Hafsa.
Okay, thank you, Is.
Okay.
Thank you, Jazlina, for the excellent talk. I think we receive a lot of useful information. Lagi dah nak beberapa hari je sebelum Ramadan kan. Tapi I think kalau ada apa-apa soalan yang ataupun cadangan untuk sesi-sesi seterusnya, silakan message pada kami ataupun boleh hubungi mana-mana ahli jawatankuasa CME, MedFitMy, dan insyaAllah kami akan cuba cari speaker yang sesuai. I think this might be the first talk on diet, is that right?
Yes.
So mungkin selepas ni mungkin ada permintaan untuk diet yang spesifik untuk pesakit-pesakit tertentu macam pesakit buah pinggang ke, pesakit diabetes kan. Jadi mungkin kita boleh fikirkan topik untuk seterusnya untuk pesakit-pesakit dalam sesi CME selepas puasa mungkin. Ada apa-apa take home message ke Jaz yang kita boleh berikan pada penonton kat luar sana?
Selamat berpuasa and especially Ramadan ni akan jadi saya rasa antara salah satu waktu untuk kita fine tune balik kita punya diet lah. So of course saya sangat suggest ada sahur and then kawal waktu berbuka.
Macam Jaz kata tadi, ambil waktu sahur kalau boleh dekat dengan waktu start mula puasa dan ambil berbuka seawal mungkin. Ambil makanan yang tinggi serat pada waktu sahur dan makanan tinggi serat ni boleh menyebabkan kita rasa macam kenyang kan dan boleh last for the whole day. Dan yang penting dapatkan nasihat doktor kalau ada masalah kesihatan tertentu sebab mungkin ada adjustment dari segi medication kan, dari segi ubat dan dari segi diet juga. So I think that's all for now. Thank you so much again, Jaz. I think if there's no other question, we'll wrap up. Thank you so much for joining us tonight. And I think we, for next weekend, we have the first session for CME community. So we're really excited because this is an expansion of CME program. Now we're from back to basics sessions. We have the CME for community as well. So it will start off next weekend with Dr. Fakhrul Razi will be heading the program. So it will be the same time next week. Masa yang sama 8:30 malam. Dan mungkin kalau ada perubahan dari segi masa, mungkin kita akan war-warkan pada platform Facebook, Twitter dan Instagram. Jadi terima kasih semua kerana menyertai kami malam ni. Kita jumpa lagi minggu depan. Assalamualaikum.